Just to turn to you, Dermot, what would you be saying if you could sit down with the new health minister about what their priorities should be?
Well, as a definite disabled person from the North here, there is quite a lot of priorities that need to be listed. The population-wise, disabled people make up 25% of the country. So people need to care for complex needs. So there needs to be a clear pathway to avoid the A&E, because at the moment, as you know, the waiting list and get access to emergency treatment is at an all-time high. As somebody had said to me yesterday, it's almost like being in the Hunger Games, trying to get seen in A&E. There's definitely disabled people, we're adding pressure to an already struggling NHS. So we do need to look at a system that we can get rapid care clinic, which is only available for people who are 55 and over. So it needs to be looked at that disabled people could get access to this as well. Now, from a personal point of view, about 8 years ago, I had a big struggle to get access to rare disease treatment, for a drug called Vimizim. So I had a fight with the Stormont Government in Westminster to secure funding for the health service to get my treatment. And I know from my own experience and chatting to other people that is very stressful, both physically and mentally on the disabled people who are trying to access this treatment. So there needs to be a clear pathway to get funding secured. Another key priority is to reopen the Independent Living Fund. Now, currently, it's been closed for a good number of years. People who have already been on it are still on it, but to date, nobody has been able to access it and get new funding. So that really needs to be looked at by whoever the new health minister comes in, because that will increase the quality of life for anybody who is disabled to live if they get this. And one final point that I think that needs to be highlighted, extremely important. There's a lot of hospitals and clinics across Northern Ireland who do not have changing places facilities. Now, changing places facility is for severely disabled people, that provide a wet room in some cases. It has a house and adult size changing benches. Now, surprisingly, there is a lot of hospitals and clinics that do not have this, which means that guardians and parents, or whoever it might be, cannot lift their adult partners or children, and they have to change them on the floor, which is unhygienic. So these are like a few things that I think that needs to be looked at whoever the new health minister is coming on. And I know this person has a big job in the hand, whoever it might be.
Dermot, thanks very much for that. Great to talk to you. Thank you very much.